Let's discuss malaria. Malaria is a vector-borne disease that is predominant in Africa and in Asia. It is responsible for deaths of especially infants and children and in older people. Developing world is facing burden of malaria. So we will discuss this session according to following learning objectives. First, we'll discuss the epidemiology of malaria. What is vector of malaria? What is causative agent of malaria? Then we will discuss the life cycle of Plasmodium. What are various clinical features of malaria? How can we diagnose malaria? What is treatment of malaria according to WHO guidelines? How can we prevent malaria? What are various malaria control programs? What are various indicators of malaria? And then we'll summarize the session. So let's start. The vector-borne disease. Malaria is a vector-borne disease. Which vector? Anopheles mosquito, female Anopheles mosquito is responsible for spread of malaria. As you can see that malaria is the most devastating parasitic infection. 40% of world population is affected with malaria. WHO estimates that there are 350 to 500 million cases of malaria worldwide, 2 to 2 million cases in India. Cases are predominant in Pakistan. What are various risk factors of getting malaria? Travelers, people who are traveling to a country or to a region where cases of malaria are present, where malaria is common, people who are not taking medicine to prevent malaria because it is essential to take medicine before traveling. People who sleep outdoors, especially in rural areas, people tend to sleep or people used to sleep outdoors. So it is predominant in male. So mosquitoes are very active at night time. People don't take steps to protect themselves. Young children and infants are at high risk. Pregnant women, they are at high risk. Malaria is severe in pregnant women and it causes splenomegaly. It may be removed. Poverty, lack of education, lack of awareness. What are personal protective measures? How can we prevent malaria? How can we prevent bite? This play an important role in transmission of malaria. Vector, as we have discussed that female Anopheles mosquito is the vector for malaria, the primary host. And what is causative agent? This Plasmodium is causative agent of malaria. Four species are most important. Plasmodium falciparum, Plasmodium malariae, Plasmodium ovale, Plasmodium vivax. Most dangerous and severe form of malaria is caused by Plasmodium falciparum. Vivax is most common. And what is life cycle of malaria? Sexual cycle is completed in mosquito. Like when mosquito bites human, it forms zygote, then occinate, then oocyst grows, and then it forms sporozoites, which are transferred to human beings after bite. So remember, there is a common MCQ that sexual cycle of malaria is completed in mosquito, and asexual cycle is completed in men or human beings. Mosquito injects sporozoites, then the trophozoites are formed, then microgametes are formed, and microgametes are transferred to mosquitoes. When female Anopheles mosquito bites infected person, microgametes are transferred. So this is asexual cycle which is completed in human beings. And common MCU is sporozoites are injected by infected mosquito to human beings. What are the common symptoms? There may be fever. There is high grade fever, high grade intermittent fever. Remember the diagnostic point, intermittent fever. Fever subsides after some times without any medication. That is intermittent fever. There are chills, there are sweats, there may be headache, there may be nausea and vomiting, there may be body pain, there may be generalized malaise. As you can see that there is general headache, you start from head, then there is systemic fever, then muscular fatigue and pain. There can be back pain. Fever is with chills and sweating. There can be dry cough And spleen can be enlarged, spleen may be enlarged in case of malaria. There may be nausea and vomiting. So remember, fever, headache, muscular fatigue, and especially intermittent fever. They are symptoms of malaria. How we can diagnose? We can diagnose malaria by clinical features and by laboratory findings. We can do blood film, we can thin films, QBC. What is QBC system? It's fluorescence microscopy. It's a rapid system of diagnosing malaria, and we can diagnose malaria through PCR. So usually we perform blood film, thick film and thin film. These tests are performed and parasite is isolated from blood. As soon as parasites are diagnosed and malaria is diagnosed, we need to treat the case of malaria cause it can form propagation, it can cause propagated epidemic. So we need to control malaria. Nowadays, World Health Organization has recommended artemisinin based combined treatment. What is ACT? Artemisinin based combined treatment. In old days, single treatment were given, which may have nausea, vomiting, and severe sign complications or side effects. But nowadays, combined treatment is given. Artemether and lumefantrine is given. Artemisinin, amiodarquine is given. Then maybe mefloquine. So this treatment is given to control malaria or to treat malarial cases. So common question or common MC question is, according to current guidelines, most effective treatment against malaria is artemisinin based combined treatment. You have to remember this. Most important thing is prevention of malaria. We can prevent malaria. Malaria is a preventable disease. We, we can control mosquitoes. Vector control. It is done at community level. Vector like mosquito should be killed by spraying. There should be personal protective measures against mosquito bites. They bite and inject sporocytes. So personal protective measures should be taken like nets, full sleeves. There may be larval control. Larvae should be controlled. They can be eaten by fish, crabs. Then personal protection. Most important thing is personal protective measures. People should use loose fittings, long trousers, long sleeves, especially who sleep outdoors, cause mosquito bite in the evening time. Health education. Awareness is very important. Health education regarding vector control, regarding personal protective measures, personal protection. We need to educate our community so that we can reduce the burden of malaria. Commonly asked question is, what is A, B, C, D, E of malarial prevention? You can just remember A for awareness. We need to create awareness through health education. Bite prevention. How bite can be prevented? By full sleeves, by mosquito nets. Remember mosquito nets. Best preventive measure against malaria is mosquito nets. Then there should be chemoprophylaxis. People who are traveling to high endemic areas, people who are traveling to epidemic areas should be given chemoprophylaxis. Then diagnosis as early as possible to stop the transmission. Then there should be emergency or standby treatment. Treatment kit should be provided. As soon as there is intermittent fever, people who are developing high grade fever, they should be treated. So this is A, B, C, D, E of malaria prevention. Then there are few programs to control malaria. There is rollback malaria program. There is coordination. Global coordination is established. There is global coordination. Then it is transferred to country level. Then at divisional level. Then at local level, a coordination system is established. Aim is to control malaria. Aim is to eliminate malaria. Aim is to reduce mortality. Aim is to reduce morbidity. Aim is to reduce burden. Aim is to reduce complications of malaria, because people may die due to complications of malaria. And there is malaria eradication program by the year 2030. WHO is planning to eradicate malaria. Developed countries, they have already eradicated malaria. It's a common of developing world. It's a common of Africa. Malaria eradication is achieved nowadays. Vaccine has been established against malaria. Trials are successful. So people who are living in high risk areas should be vaccinated before the year 2030 so that we can eradicate malaria globally, like polio, like smallpox. It should be eradicated in order to prevent deaths, in order to prevent mortality, in order to reduce mortality. And then there is a question, there is a university question, what are various indices of malaria? As you know that there is spleen enlargement, so there is spleen index. We can take average enlarged spleen. Sporocyte rate can be an indicator. Trophocyte rate can be an indicator. And most important, infant parasite rate. This is asked in university. Which one is most sensitive index? You can say infant parasite rate. So it is most sensitive index. Now we will summarize the session. We have discussed transmission of malaria, globally. Malaria is responsible from 300 million to 500 million cases worldwide every year. It causes millions of deaths, especially in Africa and in Southeast Asia. Malaria is a vector-borne disease that spreads through female Anopheles mosquito. Remember, Anopheles mosquito is the vector. Causative agent is Plasmodium. So you can say that Plasmodium is causative agent. There are four species of Plasmodium: ovale, vivax, falciparum, and malariae. Falciparum causes cerebral malaria. Sexual cycle of malaria is completed in mosquito, and asexual cycle is completed in human beings. Mosquito transfers sporozoites to human beings. This is a common MCQ. Then after completion of cycle, signs and symptoms appear. There is high grade intermittent fever with chills, with rigors, with sweats. There may be abdominal pain, nausea, vomiting, headache, body pains. It can be diagnosed by thick and thin films. PCR. We can also do PCR. Once malaria is diagnosed, we need to treat malaria. So we can give artemisinin based combined treatment. Things to remember: which one is vector, causative agent, signs and symptoms, lab diagnosis, treatment, prevention, plus malaria cycle. So artemisinin based combined treatment is given. Then there is prevention. How can we prevent malaria? By vector control, by larval control, by personal protective measures, by mosquito nets, by vaccination. Nowadays, vaccine is available. And then we discussed Malaria control strategies. We discuss rollback malaria, malaria eradication program, then ABCD of malaria. We also discuss indicators or indices. What is rollback malaria? There is coordination between global level, district level, divisional level, and local level to control malaria by spraying, by providing personal protective measures, by educating the people. Then malaria should be eradicated from globe by the year 2030. What is ABCD? We need to create awareness, bite protection, chemoprophylaxis, diagnosis, and emergency management. We need to manage cases of malaria in order to stop transmission. Then we discuss indices. Spleen rate, average enlarged spleen, trophocyte rate, merocyte rate, and most sensitive index is infant parasite rate. So, control and prevention is usually asked in university by the perspective of our subject. So, you need to remember control and prevention, causative agent and vector, and indices. That's all.